All right, everybody, welcome to this topic. My name is Snizhana Weber. I am an exercise physiologist for outpatient cardiac and pulmonary rehabilitation here in North City Hospital. I work with post-COVID patients on Tuesday and Thursdays in outpatient rehabilitation. And we've been seeing patients, post-COVID patients since actually May of 2020. So we have quite some experience to work with those patients. And today we're going to discuss how to start resistance training right after your recovery and coming back home, or if you been sick and stayed at home. We'll just talk about kind of a safe way to come back to physical activity. And specifically, we will talk today about strength training or resistance training for post-COVID patients. And we'll discuss muscle function and what muscle is. So I hopefully, today's topic will help you to think in a different way, how to incorporate different type of activities and very helpful exercise that will help you to go back to your everyday things to do that you like doing and actually start a safe and good exercise program. So let's go ahead and look at safe return to physical activity. So I hope everybody really understands that physical activity is a key component for long-term recovery from illness. And most of you, looking forward to go back to things how they used to be and, get stronger and get to your everyday things without feeling really extreme fatigue or, shortness of breath, or not to be able to, complete things that used to really not take that much effort. So specifically, before we actually jump to really practical application of resistance training and muscle function, I just kind of want to make sure that we realize that it takes time to go back to everyday activity. And I would like to emphasize kind of a graded return to the physical activity. So I put in my notes, kind of keep in mind when I said symptoms free for about 7 days. For a lot of patients, actually, it's quite impossible. And when I say symptoms free, I really don't mean that you don't feel any shortness of breath or you don't feel any extreme fatigue, because shortness of breath, extreme fatigue, maybe elevated heart rate and things like that, might be still present, really present in your life. But when we talk about symptoms free from COVID, it's you don't really have fever, and you were advised by your physician gradually start, light physical activity. So that's kind of, we're looking about a week or so. You can start the rehabilitation if it's something you would like to do, or maybe start home exercise program if you did something like that before you got sick. So we always recommend to our patients resume physical activities about 15 minutes of very light activity. Example would be of light activity, light walking, maybe if you have a recumbent bike or bicycle, something like that. So just kind of a nice, easy, not much effort. Ideally, if you can do it nonstop for about 10-15 minutes. And if a week or so and you feel like, hey, I'm ready to actually extend duration of my exercise and incorporate other activities like body weight exercises, resistance training, yoga, maybe tai chi, maybe you did some different type of activities before that is low impact activities and they are not high intensity. Okay, so again, today we're going specifically talk about resistance training. So we're going to unpack what is resistance training, how we need to look at strength training differently, specifically for people who are recovering from post-COVID, okay? So to define strength training, so strength training, resistance training, weight training, it's kind of, umbrella term. So for resistance training, right? So it can be different names, but actually it means all the same. It's when we use a force against resistance, right? When we are applying some type of massive force against the resistance that we choose. So example would be your own body weight, right? So just kind of sitting down on the chair, getting up, maybe standing movement against the wall like push-ups and things like that. Some people have elastic resistance band. If you ever did physical therapy, you probably have something like that at home. Free weights, light free weights. We're not looking for anything heavy, nice light free weights. And if you ever, been at YMCA or Planet Fitness or in our hospital fitness center, you would probably see different type of weight machines, right? So when you sit down on weight machine and work different type of groups, so the muscle groups. So that is what resistance training is. I see sometimes a little bit of confusion when people think that, well, I walk a lot or I use bicycles, so it's kind of the same. I really don't need to do strength training. So those things, they do have the same benefits, but they really are different, right? If that would be the same, walking on a treadmill or walking outside and using weights, we would just choose one another and have the same outcomes. But unfortunately, one is really cardiovascular fitness, which helps your heart and lungs and improve your stamina. And resistance training, that's what it is. It actually works on your strengths and muscle function, right? So it kind of complement that cardiovascular fitness. So in order for us to have a good rehabilitation, good exercise program, and recover from COVID, from all those things that happened to us, we really need to look at a rounded exercise program and incorporate both of those things. So why we actually not just talking about cardiovascular fitness today, but we really trying to concentrate on strength training. So what we see, what I see in our practice, in our rehabilitation, when patients been sick with COVID for a long time, sometimes we're talking about months, weeks in the hospital, or some people maybe were at home and they went in the hospital briefly, but they still having a hard time to recover. What I've noticed when I have them back to my rehabilitation, they're really struggling with muscle mass loss, and it's really challenging for them not just do something for a long period of time, just like walking, but they really having a lot of challenges doing resistance training and picking up those weights and doing everyday activity that will require some type of strength, right? And muscle function or muscle mass, right? The muscle that you have and strengths of the body, they do come together, right? So we want to make sure that we have an adequate amount of muscle and actually use it in our advantage for our strengths, okay? So when you think about muscle, what I want you to think about as muscle is it's a tissue, it's a metabolically active tissue, okay? So it's something that I always tell my patients, it's kind of a built-in anti-aging system. You already have those muscles and you got to use them in your advantage. So when you look at, lean muscle mass, human body has about 650 to 700 muscles. So it's a lot of muscles. We don't use them all. So in some ways they might be, underused, overused, dysfunctional. We have injuries and kind of, don't use them in a full capacity. But we do have already, those muscles that does a lot of good things for us. So when we think about muscles and body fat, both of them play roles. So we want to have some fat, but at the same time, we want to have more, muscle tissue, because again, like I said, they're metabolically active. So those two of those things important, but they do have a different roles. When we're looking at what really muscles do in our body. And after that, we think about, post-COVID or COVID as infection, as a disease, what happens to our muscles, how much lean muscle mass we use, and strengths we use and lose, and stamina. So it can be quite devastating for a lot of people. If you've been sick for a long time and you spend weeks in the hospital, you're going to lose weight, and unfortunately, it's not necessarily healthy weight loss. It's not like we're losing all, fat tissues. We actually, unfortunately, are doing both. We're losing our strengths and lean muscle mass. And other things is happening, and it makes us weak. And by the time we get home, we feel, sicker than we were actually even before. So again, when you think about strength training, so I kind of put a couple things, more than a couple things for you to think, what does it actually do in your body, how it, supports connective tissue and tendons, and help body composition and strength and stamina, endurance, aerobic capacity, because heart is muscle. So a lot of sometimes you forget that it's a very active muscle. Okay. So also a lot of people post-COVID might have, because of taking different type of medications, they might face some blood sugar challenges. So muscles actually improve glucose or blood sugar tolerance and insulin sensitivity. So it kind of, like I said, like a built anti-aging system just gets in and picks up all that, unused sugar and removes it. So it definitely plays a crucial role in recovery. And unfortunately, through the illness, we do lose that strength and muscles. So we'll just kind of carry on and talk a little bit about specifically what's happening, kind of troubleshoot that type of, effect as loss of muscle mass. And now the name some of you might heard is sarcopenia, or both of those kind of, you can use muscle mass loss or sarcopenia. So sarcopenia basically is happening to patients when they stay inactive due to illness for a long period of time. And if you look at that picture, you will see that that's basically they have the same amount of muscles, but the size is different, right? So on my left is probably your right. On your right, you will see a nice, thick, full muscle mass. And on my left, you see somebody who has kind of a shrinking, really not, there's not much tone to those muscles, those tissues, they kind of, loss happened. And it does affect your mobility, frailty, and unfortunately, we know now that it does increase risk of mortality, right? So when we don't have enough lean muscle mass, it actually creates other issues and challenges in patients' health and recovery, things like that. So a couple things that I really want to mention with post-COVID recovery, strength training, and sarcopenia. So like number one, like I said, that it comes down to inactivity. So sarcopenia does happen, or muscle mass loss does happen when somebody is inactive for a long period of time, when somebody is not putting any force or challenge on their body, they're losing weight, and as a result, they're losing strength and muscle mass. Muscles responsible for oxygen move, right? So when you take breath in, that oxygen goes to your lungs, it goes to your blood, and after that, it goes to your muscles, right? So it's not just your lungs. So there is a, kind of a journey of oxygen happening inside your body. So when we actually have, muscle mass loss, or, not active for a long period of time, it makes us more shortness of breath. So it makes us more fatigued because we don't have enough those tissues to support the function of the body. Okay, so inactivity is definitely something that is prevalent with sarcopenia. Next one is it's nutritional. So muscles actually do need to have nutrients. They need to be fed in order to stay strong. So muscles have branched-chain amino acids. It's kind of a building block that communicate with each other in order to stay strong. So some of you maybe heard that, some people take protein shakes and things like that. Protein per se does not build muscle, but it does help support the muscle tissue. So if you, again, not feeling good, or you lost your appetite, or not hungry for things that you used to like that were good for you, so it can be quite challenging to meet those protein requirements. And when we talk about protein, we mean, chicken, eggs, lean beef, maybe if you like fish and things like that. So some plant-based protein might be appropriate too. So a lot of people kind of, again, it's just not just exercise. It also comes to nutrition, kind of decreasing that inflammation in your body and things like that. So in activity, nutrition, and next one is vitamin D. So D also helps with muscle function. Again, some of you might sometimes take calcium and with vitamin D for your bones. So maybe your doctor told you, to take vitamin D. So things like that might be appropriate to discuss with your physician and say, hey, really with, coming back from the illness and recovery and getting those muscles back and getting strength back, I can get all the help I can, start exercise, look at nutrition, and talk to your physician about some type of recommendation, testing vitamin D, and kind of see what can be done for you if it's appropriate. So now let's talk about kind of a practical things. What is, what should we do? How it's going to look for most of us when we decided to actually, hey, I need to start building some type of resistance training for myself. Again, so when we think about resistance training, don't make it too complicated. If you don't have any weights or anything available at home, it can be just only body weight. And in the beginning, it can be just enough. Use your own body weight. But if you have a couple light weights or resistance bands, or want to buy something like that, it's really not that expensive. Probably any stores or online stores, you can find something that is affordable for most people. So generally, resistance training will be divided to sets, kind of, and repetition. So I will just give you example how it might look and kind of explain what we do in our rehabilitation for our patients. If you're wondering what should you do first, walk or do weights, or do weights first and after that walk. Reality is, it really does not matter. If you go for a day of exercise to work on your strengths, do your resistance training first, and after that you might walk or bike for a little bit. If you want to work on your stamina and cardiovascular fitness, you might do walking first and do weights maybe at night, or kind of divide that. But again, pay attention to your symptoms. Start slow, don't overdo it, be patient, just take your time, right? And see, like, hey, I feel good, I don't feel fatigue, I can add on for a little bit. So I just kind of want you to think about, based on your symptoms and previous experience. So if you did probably resistance training before, it will be a little bit easier for you. If you have never done anything like that before, it might take a little bit of time, just kind of learn the technique down and a safe form, and kind of breathing patterns and things like that. So in our rehabilitation for our patients, we actually just do one set. So I kind of recommend 2 to 3 sets to progress. But again, if it's just the beginning, one set is enough. So we're going to do 1 to 2 sets. It means how many times you repeat exercise that you choose. 12 to 15 repetitions. So you might say maybe 12 to 15 is too much. You can do 6 to 8, right? 6, 8, or 10. So if you feel like, oh, maybe 20, I can do more than 15, that's fine too. Just choose how many repetition reps you're going to do for a specific exercise. So when you think about choosing weight, or how difficult it's supposed to be, if it's only your body weight, right, just choose how many repetition. If you have some type of light weights or resistance bands, it should be um, challenging, that you feel your muscles do get overload and work, but not on the point that you cannot complete your assigned repetitions, right? So that you challenged, but not also overdoing it, right? So you want to feel good next day. So my rule is always commit to less, that you can show up more. So commit to less repetition, that you actually feel good, and you can come back and not feeling too fatigued. And if you decided, maybe challenge yourself a little bit, with more weight or more repetition or more sets, that's again, I think it's appropriate. So it's something that you just need to, monitor. Rest between exercise. The biggest challenge I see for post-COVID patients is really learning that pacing technique, right? So I need to pace myself. It's not all about go, 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 and I feel really fatigued, or I just can't breathe, or I feel really tired, or I have to have, 3 hours nap after that. So pacing is number one goal. So we want to make sure that we don't inflame our tendons, don't inflame our body, even through exercise, so that we're very gentle, doing good, getting those muscles working, but not overdoing on the point, that we actually don't feel good and don't want to come back and do it again. Um, 5 to 10 minutes, right? So if we walk light, cardiovascular exercise for 15 minutes, adding 5 to 10 minutes of resistance training will be appropriate. Some of you might say, well, that's not enough. Believe me, that's enough. So if you've been sick for so long and you are not doing anything for so long, 5 minutes is better than 0 minutes. So commit to less, that you can show up more, and eventually you can progress to 15 to 20 minutes. In our rehabilitation, that's exactly what we do. We start about 5 to 7 minutes, light exercises with some breathing technique, resting between those exercises, and eventually I advise my patients, if it's appropriate, do 15 to 20 minutes at home, 1 to 2 days a week. So it really does not, when you really look at resistance training specifically, does not take that much time from your week or from your day. So, and I want to kind of stress out consistency of exercise. So I would rather you to do it 2 days a week and be consistent than be kind of sporadically, or do too much and skip a week and so on. So consistency does help. Consistency will help to regain those muscle function back, to get those muscles working again and making you stronger, and get your stamina and strength back. For everybody will be different, right? So, but eventually, over time, you will see, uh, huge improvement. And I always say, hey, it's such a small investment, just a couple of days a week, and a huge payback. Um, some again, 1 to 2 days a week. Some of you, if you if you did resistance training before, you might say, hey, I can progress to 3 days a week. I wouldn't do more than that. So I would say, hey, be consistent, kind of do different type of I call it diverse exercise program. So you have a diversity, so that is different type of exercises, and kind of combination between cardiovascular and resistance training. Think about complex movement that involves large muscle groups. So when you think about human body, just kind of look at yourself, ask, where do I have large muscle groups? So that will be your legs, right? Your chest, your back muscles. So it's not necessarily just biceps. So if you're kind of doing some type of movement just for your biceps, it's really not going to do much for your whole body. And the biggest challenge you might be noticing since recovering from COVID is fatigue, right? Specifically, walking, or leg pain, or leg fatigue. shortness of breath, just general fatigue. So those all involves large muscle groups. So you want to make sure that you exercise those muscle groups. So maybe doing body weight squats, right? And after that, move to light exercise, or doing kind of, against the wall or against kitchen sinks, those wall push-ups that involves your chest and your core and stability. And after that, maybe move to calf raises, which is kind of easier and doesn't require as much energy and oxygen and effort to do. Okay. So this is kind of basic, foundation. So when you think and plan your own resistance training, again, some low body like squats, some overhead movements like maybe a shoulder press, some biceps, small muscle group, biceps, calf muscles between those large complex exercises. So, and I would do, upper body and lower body in one session, right? So save yourself some time, choose three, 4 exercises and just kind of repeat, different repetitions, 12 to 15 a couple of times around. Okay, very simple. Some of you might find beneficial to go to YouTube, and YouTube has a lot of, I would just probably kind of search beginner exercise programs, maybe just have an idea. Just make sure that they're safe, not too complex type of exercises. Final thoughts. So when we really think about lifting weights, I do hear this a lot, that it doesn't come natural to people. So I want you to find a way to love it, right? So if you can find a way to love, lifting weights, or think about is that, investing in your own health. Kind of look at the notes again and say, hey, yeah, really, my muscles responsible for many, 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 many things. And if I want to have, healthy body and aging gracefully and recover faster from my illness and protect myself from the future chronic diseases, I really need to invest in, doing some type of resistance training. Think of resistance exercise as a pill. It's one that you cannot afford to skip too often, right? So you just, maybe have a different work on your mindset, like, hey, I cannot afford not to exercise, or I really, don't find it maybe very exciting to do weights, but I can do it, twice a week for about 5 minutes, and it's just 10 minutes, a week. And over time, I'll be really amazed, like, hey, I actually can pick up my groceries and do all those things a little bit easier than I used to do them. So they just don't take all that effort to do. So that's my email. So I'm here in North Carolina City Hospital. If you have any questions, just email me. If you need slides, you can also email, and I will be more than happy to email back slides to you. If you have any questions, or if you want to know about our pulmonary rehabilitation for post-COVID patients and what we do and what does it take to see us, just give us a call or email us. Or I know I have a little magazine that we all get at I have it at my mailbox, so you can also contact health education department in the hospital, and they can kind of guide you through where you can seek more information and find out more about our rehabilitation. Well, thank you so much for joining us again. It's always a pleasure to guys see you and talk to you and kind of connect on that level. And I hope that you find it helpful for yourself. Thank you so much.